The CDC says flu cases are surging across the country, including right here in South Carolina.
The agency reports more than 10,000 confirmed cases from January 26th to February 1st alone. News 13 Skylar Music went to McLeod Health in Carolina Forest to learn more about the rise in flu and COVID cases along the Grand Strand.
McLeod staff say many patients have influenza A, which tends to have the most physical impacts on patients, like fever and vomiting.
I feel like it's been at least one a day. It's very, very common. I think I saw maybe 4 or 5 last week in particular. And those are just the patients I saw in person. I've had plenty reaching out to me either through my chart or through the phone saying that they've had very similar symptoms to flu as well.
McLeod staff say they're also seeing a rise in COVID cases, which is typical this time of year.
In my experience, a lot of patients are no longer receiving the COVID vaccines, so that could come into play as well. But it's also such a rapidly evolving virus that sometimes the vaccines don't really cover for every single strain.
Physician's assistant Anna Lark also says most of the flu patients she's seen this season did not get the vaccine. She says the flu vaccine can protect against some but not all strains of the virus, so you can still get the flu multiple times in one season. But the vaccine is meant to keep patients out of the hospital and with milder symptoms. If you do get sick, health officials recommend you stay home, rest, and drink lots of fluids.
Cleaning your doorknobs if you know somebody's been sick and they've been touching things. Then of course, if you or someone you know is having symptoms, recommend that you do wear a mask to kind of help prevent transmitting that virus to other people.
Lark says McLeod offers the flu vaccine until March. She recommends getting the shot as soon as possible because it takes a few weeks for your body to build immunity against the virus. Reporting in Carolina Forest, Skylar Music, News 13.